At the healthcare facility level, different contexts and types of facilities will face different challenges. A list of healthcare facility core elements has been developed to guide facility management in building the structures needed to enable implementation of sustainable AMS programs in their facility. Essential healthcare facility requirements include basic core elements requiring fewer resources and advanced core elements requiring more resources. However, this differentiation may vary from country to country and facility to facility based on size, needs, priorities, resources, and context. There are 6 healthcare facility core elements for AMS programs in LMICs. They include leadership commitment, accountability and responsibilities, AMS actions, education and training, monitoring and surveillance, reporting and feedback. Even within a small facility, the healthcare facility administrator or manager, AMS committee and/or AMS team or person are encouraged to identify which core elements are already in place, the level of implementation, what requires accelerated implementation, what is missing. This information will help in developing a facility stepwise implementation plan over the short and medium or long term for the prioritized missing core elements and accelerate implementation of existing ones. For a small facility, it may be necessary to collaborate with other healthcare facilities to put certain core elements in place. For example, AMS expertise, education and training, standard treatment guidelines, and AMC surveillance system. Here is a quick guide to navigating the healthcare facility core elements checklist to identify, prioritize, and develop a stepwise implementation plan over the short and medium or long term. Some questions to ask are: is the core element in place in your facility? If yes, is it fully implemented? Or is it partially implemented? If not, is this a priority for the short term? Or is this a priority for the medium or long term? The first section addresses leadership commitment. As you go through the checklist, tick yes or no, depending on whether the core element is in place. This includes the following: 1. That the facility management has identified AMS as a priority objective. 2. A healthcare facility AMS action plan is endorsed that prioritizes activities and measures progress and accountability. 3. There is dedicated, sustainable and budgeted financial support for the facility AMS action plan. The second section focuses on accountability and responsibilities. This includes the following: 4. There is a multidisciplinary AMS leadership committee in place with clear terms of reference. This committee can be either standalone or embedded in other existing structures, such as the Infection Control or Drug and Therapeutics Committee. 5. A dedicated AMS leader or champion has been identified at the healthcare facility. 6. There is a multidisciplinary AMS team with terms of reference who will implement the day-to-day AMS activities in the healthcare facility. 7. Other health professionals apart from the AMS team have been identified and involved in AMS activities. 8. There is clearly defined collaboration between the AMS and IPC programs. 9A. There are regular descriptive activity reports on the implementation of the AMS program that are being produced and disseminated. 9B. There are regular activity report status and outcomes on the implementation of the AMS program being produced and disseminated. This is an advanced core element. The third section covers AMS actions. Examples of core elements in this section include: 10. The healthcare facility has up-to-date standard treatment guidelines. 11. Regular AMS team review or audit of specified antibiotic therapy or clinical conditions at the healthcare facility are being conducted. 12. Advice or feedback from AMS team members is easily available to all prescribers. 13. The AMS team conducts regular ward rounds and other AMS interventions in select healthcare facility departments. 14A. The healthcare facility has a formulary with a list of approved antibiotics. 14B. The healthcare facility has a formulary with a list of restricted antibiotics that require additional approval. This is an advanced core element. 15. The facility has access to laboratory and imaging services to support AMS interventions. This is also an advanced core element. 16. The healthcare facility has access to IT services to support AMS activities. 17A. There are standardized prescription charts, medical records and transfer notes. 17B. There is a written policy that requires prescribers to clearly document the indication and antibiotics prescribed. This is an advanced core element. The fourth section addresses education and training. This includes the following. 18. Basic training in optimal antibiotic use is being provided to healthcare professionals. 19. Continued training on optimal antibiotic use is being provided to healthcare professionals. 20. The facility offers initial and regular training of the AMS team in infection management and AMS. The fifth section is about monitoring and surveillance. This includes the following. 21. The AMS team monitors the appropriateness of antibiotic use at the unit and/or facility-wide level through audits or point prevalence surveys. 22. Monitoring the quantity and types of antibiotic use at the unit and/or facility-wide level takes place. 23. Monitoring of antibiotic susceptibility and resistance rates for a range of key indicator bacteria takes place. 24. The AMS committee monitors the compliance of AMS interventions. The sixth and final section covers reporting and feedback. This includes the following. 25. There is regular evaluation and sharing of healthcare facility data on antibiotic use with prescribers. 26. There is regular evaluation and sharing of facility resistance rates with prescribers. 27. The evaluation of appropriateness of data on antibiotic use is shared with prescribers. 28. The facility antibiogram for key antibiotics is informed by data on antibiotic use and resistance. You have reached the end of Module 2. Try to answer these questions to check your understanding so far.